So let's take a look at a few of these factors that I take into account with my athletes prior to returning to sport. Let's get the first factor out of the way, time. So as we mentioned, 9 months is the gold standard that we look at for full return to sport, or at least that bare minimum. This isn't necessarily an arbitrary number. Based off current research or past 5 to 10 years of research, we see that at 9 months leading all the way up to 2 years, this is when the graft actually starts to show signs of maturity. It starts to integrate into the joint and certainly starts to change from what we use as a tendon and turns into a ligament. So number 2, next one we have is physical readiness. So this is what we would think as kind of the most obvious component that we see for return to sport. This is range of motion appropriate? Is there still swelling in the joint? What about strength? Hamstring strength, quad strength, hop testing, all of these metrics that we use from a physical readiness standpoint. The next one that we have is psychological readiness. The way I describe this to my athletes is there's 2 spectrums to an athlete generally that I see in my practice. One athlete who is overly cautious, a little bit tentative, apprehensive to do certain things that their sport requires. On the other side of the spectrum is someone who is a little bit too overconfident to get back, and they're pushing the rehab process. They're doing things maybe that aren't appropriate during the timeline. The way I say this is I want someone to be somewhere right in the middle.